Welcome back to the program as we're celebrating Democracy Day, even though we're in the COVID-19 era. We've already kicked off the conversation. We started with health, obviously, as that is a key point right now. We spoke to the Honorable Minister just a few minutes ago, but we were not going to be doing all the talking. We'd like to hear from you. The hashtag is June 12. We also have hashtag Democracy Day and hashtag Democracy Day 2020. Tell us what you expect on a day like this, even though we're celebrating it this particular way right now. Could be electricity, whatever it is you have to say. If it's a question, do send us that by the Twitter or all of the hashtags that we've reeled out, Vladi.
Many hashtags, many comments, many issues to talk about. But we're staying focused on health because, of course, that has taken most of the stage, not just the center stage, but most of the stage. Joining us to take a look at some of the other issues in health. First, in our Lagos studios here, we have the president of the Pharmaceutical Society of Nigeria, Mazi Sam Oabua. Thank you so much for being with us on this day. Sitting beside Mazi is Professor Rosemary Audu, who is the Director of Research, Nigerian Institute of Medical Research. Thank you so much for joining us.
It's a pleasure.
And in our Abuja studios is Dr. Aliu Sokomba, who is the President of the Nigerian Association of Resident Doctors. Dr. Sokomba, thank you for your time. Thank you for joining us. Let's kick off the discussion. Mazi, the minister has said it, the health sector is not likely to be the same after all of this, even if we are already considering an after. Even during the course of this, it's not going to be the same. If you were to identify three things that, from your perspective, would change, should change, or need to change, what would those be?
The first thing that should change is sincerity of purpose. A proper focus, a paradigm shift. You know, you can't solve a problem except you make that problem a serious matter to you and you have a determination to solve it. If problems are treated on the political sphere and nice statements are made, we're looking at it, we're planning at it. We've been planning, we've been looking at it for years. That's the first thing that should change, okay? When government says a thing, let government decide that it knows how to get it done. So often things are said, then we start to think of how it is done. When we say a thing, let us be sure that we'll follow it through. I mean, the clearest example is this issue of payment of allowances. And are we waiting for the money from World Bank or from African Development Bank to pay mere allowances to healthcare professionals? And it's taking so much time and so much argument. If this can take this time, at this time when we have an emergency and money is all over the place for managing COVID, budgeted, donated, acquired, and here we can't do such simple thing. Can you imagine how much time it should take to acquire even PPE? We're talking about going to primary health care, primary health. I like to say that this country must come to terms to decide that when it wants to do a thing, then it means to do it. That's the first. The second is that there are three things that must be done outside this issue of determination and commitment. Is that we need to rejig the health system and understand that it goes from the lowest level to the topmost level. I was glad when you brought the issue of private primary health. If our primary health care centers are well suited and well structured, resourced properly, you have properly trained staff, resourced, you get the minimum that is required, we'll get to the level where most of our ailments will be treated at the primary level, because most of them are. But today, everybody goes to the tertiary because the primary level is not cared for. So everybody ends up with headache, with typhoid, with malaria, will go to the teaching hospital. That's the system that we have. It has to change. Let the focus, I've recommended in some of my writings, that the greatest tragedy is that we are putting the most important aspects of our life to the local government. That is not resourced, not funded, not properly manned. Primary education. The people are ruined at primary level, then you wait to university to correct them. Primary health care, there is nothing on the primary health level. You go there, there's no medicine, there is no suture. If a woman wants to give delivery, she has to bring her cotton wool from home. I am telling you what is happening. I'm not here to, this is a country, we're doing a conversation as a people to decide to change our situation. So we need to focus on primary health. I had suggested, it's a constitutional thing, but I said, since the federal government seems to be the best resourced, let the federal government take care of primary health care, primary education. Let state governments take care of secondary, and let private sector take care of tertiary. Because in the tertiary, there's need for more funding, more investment, and if people get good primary health care or primary and secondary education, tertiary education can then be handled at a level that it can be funded, and then some recovery made. So my next point is that we need to change that, get sure that primary health centers, primary health points, primary community pharmacies, because community pharmacies represent also primary health care. These are places that people go first. We should pay attention to that. Number two is that we need to do a proper training and motivation of our healthcare professionals, because all the equipment you have in the hospitals and in the health centers and everywhere cannot work except you have a motivated healthcare workforce. The healthcare workforce before now was disjointed, completely at war with each other, because no attempt is made to unite and bring a coherent team concept. They work as if they were in competition. We need to get the healthcare properly educated, properly resourced, rewarded, motivated, and then build a team. And that team will be on ground ready to confront any ailment, be it the usual ailments that we have, and be it infectious diseases that do occur every once in a while. And the third, is proper funding. Nigerians and leaders in the past have thought, how do we create appropriate funding for the healthcare? The budgets that the countries and the states gave were never enough. They didn't pay attention to that. They paid attention to other things, to defense and other issues. Healthcare was always poorly made. So some guys came around and said, why don't we start a health bill, a national health bill that will make a frontline first charge to healthcare. And that was a health bill that was proposed that 1% of, I think, the 1% of our revenue or budgeted should go to the healthcare. It took, from the time that it took many years to pass. After being passed, it's either 1 or 2 years ago, they started some bit of concessionary reluctant putting of money into that. We have a national health insurance that is dysfunctional. Everywhere in the world, people are living on health insurance.
Mazi, I need to put you on pause there.
Yes, I was just about to come to
yes.
Professor Audu, because he's talked about primary health care from the perspective of contact. But I know you've done a lot in terms of vaccine studies, and you've long been an advocate of the viruses don't wait for our healthcare system, Ebola, Lassa fever, and now COVID. From a research perspective, looking into how these viruses come and go, are we any closer to solving our problem? Where do we stand quickly?
Well, as it is right now, these viruses, just like you have mentioned, we have even polio that had been eradicated everywhere was a challenge here. Ebola, we're able to handle it, and here we are. It's like with this, more labs are just being set up, okay? So it's like we're not really prepared for it, okay? But we have what it takes to be prepared. I am just glad that with this particular pandemic, it's like everybody back to your country and fix it yourself. And so, for that reason now, people who probably would have just jumped out of the country to go get their health fixed have to be in here. So we really need to look inward and see how we can fix our own issues.
So our researchers at work, that's what I'm
Yes,
asking.
our researchers are at work. As we speak right now, in-house, we are now working on kits, test kits, okay? Test kits. We are developing, we're still working, looking for funding. Fortunately, a few people are coming out to support. So we have what it takes. We have the capacity, okay? If only we have the funds. The test kits are there, even vaccines. There are some candidate vaccines that we're still trying. There are many things we can do. At least in my institute, I do know that fortunately we had some of our staff travel abroad for training. They went to China and Institute Dakar in Senegal. And just from the 3 months, 2 months that they spent there, the knowledge they acquired is what we are using now, sequencing the virus, okay? And also even the kits, we have just this isothermal point of care. Is a PCR based, is a molecular based test, you know, which is what is recommended for COVID. And we have developed it. We're just about validating it. RNA extraction. Before now, everything we import. But since the lockdown, and we are not able to get these things, we're looking inward now. Even the sanitizers, we are developing them, we are producing them in-house. The viral transport medium, everywhere is locked. We are now producing everything. So we have everything it takes if only we invest in our own facilities in country.
Professor Odula, thank you for that. Let me go to Dr. Aliyu Sokoba. Dr. Sokoba, I don't know if you listened when the minister talked about the issue of frontline workers and the fact that the issues having to do with the allowances, which Mazio Habwa also talked about, are being addressed, and that during the coming week, all those matters, because I know that the Association of Resident Doctors are planning, or we're planning to go on downing of tools also next week. Now, with what the minister has said on this program earlier today, is there likely to be a shift in that position?
Thank you very much for having me this evening. Well, I would like to appreciate the President of the Pharmaceutical Society of Nigeria for his viewpoint. If I heard him right, he did mention that it is taking the government this long to address issues as little as payment of allowances that have been agreed upon months ago. So at the stand now, it took the government about 3 months to get to the point where we are, to get them to admit and agree that they will pay this hazard allowance and other COVID allowance that has just been promised. So what it means is that it may take a much longer time before these monies will eventually hit the account of the beneficiary. This is to tell you the reluctance that we have in the system to getting things done. Well, as the Honorable Minister has stated that these monies are being worked on, and I will want to convey that to our members for consideration. But as it stands now, what we have, it's still at the level of promises, and the promise is that these monies are being worked upon. And I must tell you that we have been on this for the past 2 months, and we are hoping that his promise will eventually materialize to a positive outcome, and these monies will hit our account.
Dr. Sokomba,
however, I must state...
Please carry on.
State that allowances has never been a major concern for us, and it has never been the major focal point for us embarking on an industrial action. What we had sought to address is the weakened health system, to address the challenges bordering on the health care, the welfare, and then the abilities of healthcare workers providing care, and lastly, to address the inequity that is already existing in the system. Hazard allowance and COVID allowance are promises the government willingly and freely made, and that is why we have added it to part of the demand we are making to embark on this industrial action. To start with, our main focus is to address the issue of the weakened health system. I'm glad we've started the discussion concerning the health system in this country, and I would have loved if you would ask me what we will do to address this problem. Number one problem I think we need to address is the issue of the health system itself, talking about the leadership and governance. You are quite aware that health, unlike other serious items, is considered under the concurrent legislative list, and when other serious fundamental human rights like the security, communications are also considered under the exclusive list. Health, according to the World Health Organization, is a fundamental human right, and we will have thought that considering the importance of health for all the people of the world, health will be given the priority it requires and be moved from the current concurrent list where it belongs to the legislative list where it should belong, so that health will be made available for all people to be able to access health care that they need, irrespective of whether they can afford to pay for it or not, without being faced with the risk of financial hardship. And that is not the case here in the country. We also have the issue of poor funding to the health sector. Recently, in 2001, the government of the people of African countries met to agree to budget 15% of their health expenditure on health. Unfortunately, as we speak, up to this moment, only about 4% of the total health is of the total expenditure is budgeted for health, and as opposed to what was agreed. As we speak now, countries like Chad is able to attain 14% allocation to health. Countries like Ghana is able to attain 13% allocation to health, and even Niger Republic, our neighbor here, has achieved the 15% allocation to health. As we speak now, we are only hovering around 4.5% of the total health expenditure on health. And recently, even the basic healthcare provision fund that the president of the Pharmaceutical Society of Nigeria is talking about, recently, in 2014, the basic healthcare provision fund, which is about 1% of the consolidated health being budgeted, consolidated revenue being allocated to health, has just been slashed in the 2020 budget that has just recently been reviewed by about 43%. That is to tell you the emphasis, the focus on providing healthcare to Nigerians.
Yes, I know, very, very passionate about it, and it's very serious issues as well. We wish we had more time to discuss it all, but I'm going to have to thank you, the President, National Association of Resident Doctors, Dr. Aliyu Sokomba, for joining us on the program. Thank you so much. And here in Lagos, I'm also going to thank the President of the Pharmaceutical Society of Nigeria, Mazi Sam Ohuabunwa, and of course, Director of Research, Nigeria Institute of Medical Research, Professor Rosemary Audru. Thanks a lot for joining us on this particular segment, and Happy Democracy Day. We didn't get a chance to say that, Laddie.
Indeed. Happy Democracy Day to you. Thank you so much for coming in. We'll take a break, and when we return, we'll move on straight to the next segment, which affects just about everybody as well. Please stay on with us.